I'm Ashley.
And I'm Kristy.
And we are your sim crew.
We're going to do a room and simulator review for your first semester nursing Stan Mann simulation. We will review the simulator and the room contents, and so that you have a basic understanding of the equipment and expectations of your sim day. First up is the simulator.
All right. So this is your simulator. The simulator's name is Hale, but your patient's name today is going to be Stan Mann. He was admitted last night and is on the med-surg floor at the hospital. The first thing to note about him is that he's in droplet precautions. Sorry, I just had to, phone a friend. He's on droplet precautions. So when you see that, you are going to actually put on the appropriate PPE. So we're going to start by coming over here, and you have a PPE cart. So first thing you would do is wash your hands, and then you can take this out. I like to show this one just because it's not super common. It looks like a trash bag. So you will just open this up. I didn't practice this beforehand. Okay, so your arms will go in here like so, and this is where you will go over your head, and we actually want you to tie the gown. So you're going to tie your gown, and you can also have someone help you if you need to. We will just have you verbalize the fact that you are going to put a mask on, and you will verbalize that you're going to put on the goggles, but as long as you verbalize it, you'll be good. Then you'll grab gloves, which are over here. There are different stages with Stan, so once you come in and you have your gown on, you're going to just keep that gown with you. You're not going to throw it away, so that way you can use it again when you come back into the scenario. So then you get your gloves on, and you are ready to go. I have my mask on, and I have my goggles on. All right. This would also be a good talking point to tell you that I should probably have my hair up in a ponytail, just because I'm in droplet isolation, and I don't want to take any of that stuff that the patient has home to my family. So my hair needs to be, I think they say like high and tight, or like out of your face. All right, so let's talk about the simulator. So he has functioning eyes. So his eyes will open and shut. You can see that he's blinking there. And then he also has these blue lights. You should be able to see them. Have Kristy turn just a little bit right there. He has lights right here and up here that are blue, and that is what we use to show that the patient is cyanotic. This simulator has chest rise, so you can see when he's breathing, his chest will rise and fall. And then he also has a respiratory rate that you can listen to and count using your stethoscope. Just remember that when you are listening to the lungs, you will want to listen to all the lobes on the anterior portion, and then you will confirm with the sim staff. So if you listen and you hear clear, you'll say, sim question, I got clear lung sounds in all lobes anteriorly, and we can confirm that for you. If you want to hear the posterior lung sounds, you will just say, sim question, what are my posterior lung sounds? And then we will tell you what they are. To obtain your patient's apical heart rate, you are going to actually remove the patient's gown so that you can get onto the patient's skin. So you can just, talk to the simulator or the patient. Stan, I'm just gonna listen to your heart rate here. I'm gonna lift up your chest, or your gown here. Expose your chest. And then we want you to go through all of your cardiac landmarks. So you're gonna verbalize each location that you go to. Once you're ready to count the heart rate on the simulator, you're gonna find this black X that's right here. That's where the speaker is that you can hear the best heart tones. So once you've gone through all your landmarks and you're ready to count, you're going to take your stethoscope. We do realize that normally there would be an isolation stethoscope in the patient's room, but for sim purposes, we're going to allow you to use your own stethoscope. So you'll take your stethoscope, and you'll put it here, and this is where you will count for your heart rate. If you have trouble hearing that, it's not cheating to also palpate for that radial pulse and listen at the same time to make sure that what you're hearing and feeling match. Again, you're going to want to confirm that vital sign with the sim staff just to make sure that you are getting the correct rate. Once you confirm that, you're going to write over here on the whiteboard just so that the sim staff can also see what you have written down. All your other vital signs you're going to get off of the simulator, but you kind of got to work with us. So you're going to get your vitals part, bring it over to this side of the patient's bed. Remember, we always stand on this side of the bed just so that the sim staff and instructors can see what we're doing. And then you're going to actually go through the motions. So this would be an example of what you do not want to do in the isolation room. But if you need a blood pressure, you are going to put it on your patient's arm. All right, Stan, I'm just going to get a blood pressure from you here really quick. All right, my blood pressure cuff is on. Sim question, what is my blood pressure?
Blood pressure is 128/88.
Perfect, 128/88. And so my partner is going to write that on the board for me. Alrighty, and then we have the pulse oximeter right here. We're putting that on our patient's finger. Stan, I'm just going to put this on your finger. And sim question, what's my SpO2?
Your SpO2 is 92%.
92%. Someone writes that there for me. And next up we have temperature. All right, Stan, I'm going to have you say ah so I can get your temperature. And what's my temperature?
Temperature is 99.8.
99.8. My partner wrote that up there for me. I have my blood glucose monitor out. What is my, sim question, what is my blood sugar?
Your blood sugar is 120.
120. They wrote that for me. And then, Stan, I'm just going to check your pupils here, okay?
Okay.
So I look. And if the lighting is correct, if it's dark enough in here, he does have reactive pupils. So if they're supposed to react, they will. The sun is kind of coming in through the window right now, so I'm not seeing it quite right. But if you take your time and try, you might see it. If you don't see anything, you can just say, sim question, what are my pupils?
They are equal and reactive bilaterally.
Perfect. Okay. So that's how you're going to kind of go through a vital sign assessment on your patient. When you're doing the head-to-toe assessment, it's important to ask the sim staff for the specifics. So if you want to know if the patient has palpable pulses, you can ask, but this simulator does have carotid, brachial, and radial pulses that you can palpate. When you're assessing the skin, you're going to want to ask appropriate assessment questions, and we will answer you accordingly. So if we come over to the other side of the bed here, and again, we'll just stay on this side briefly, but we see that our patient has an IV here. So you can say, I am assessing the patient's IV site. Do I see any redness?
No, you do not.
Do I see any edema?
No, you do not.
Okay, so you guys are just kind of go through what you're looking for. You don't want to just go up to the simulator and say, I have an IV here, what does it look like? We want to know what you're looking for, okay? Then once you're done assessing that patient's IV, we're going to have you come right back on over to the other side of the bed so that we can see you. Because we talked about that patient's IV, the IV site is over there, but our IV pump is right here. This is a functioning IV, and you can push fluids and infuse fluids on the IV pump. Sorry, I have to go back over to the other side. So right here, you can see it right there. It looks like the patient has a Foley, but if you look at it, it says it's an IV drain bag, not in play. So that's all it is collecting the fluid that you put into the simulator. So you don't need to like assess the liquid or anything that's in here. All that tells you is that you can hook things up, push stuff through his IV, and the fluid's gonna go into that bag. This IV pump, when you see it here, yep, you should be good. So you see that this has the bag, it's spiked, it's hooked up, and it has a sticker on it that says 125 mLs an hour. That in sim world means that you have a hooked up IV and it is running. If you needed to change the rate for some reason, you would have to stop the IV pump. How do you turn the IV pump off, you might ask? Well, you just remove the sticker. That means that the IV pump is off. If you need to change the rate, you just take a dry erase marker over from your office stuff drawer. You erase, you write what you need, and then you stick it back on there, and boom, your IV pump is now on and running. You are going to spike the IV bag. You're going to hook up the tubing just like you did in skills. The only thing that we do not do in the sim lab is turn the IV pump on. So this, you don't have to worry about like plugging it in, turning it on. The only thing that you need to do for rates and stuff is worry about the sticker here. Make sure you do follow like what you've done in skills where you're looking at the IV site, following that tubing all the way up and assessing it throughout. We did already talk about the droplet isolation. Just make sure that you're monitoring how much you're touching your face and, excuse me. I am. Oh, yeah. Sorry, just phoning a friend there really quick. He also has task trainers on. So if you needed to give any injections, right here you can see this little pad. Perfect, right there. So you won't inject anything into the simulator, but you can inject into this little task trainer right here.
IM.
What's that?
It's IM. It's an IM.
IM. It is an IM. Yes. All right. Please make sure that you're talking to the simulator as a patient. So, Stan, this is what I'm doing. Communicate with him and listen to what he says. As a sim staff, we're playing a part. It's all a script, and so he's trying to cue you or tell you things, so listen to what he's telling you. And then you are allowed to move the bed up and down. Just be mindful the simulator is typically plugged into the wall, so you want to make sure that you're not pulling any of those cords out from the wall. Always wear gloves when you're touching the simulator, and then please say sim question if you need assistance from the sim staff or from your instructor. The famous sim question is, do you actually want me to do this? And the famous sim answer is yes. There's only a few things that you will never do in sim, and that will be like put anything in the simulator's mouth. You'll never put like the liquid of an albuterol or whatever nebulizers that you're doing. You won't put that liquid in the cup. But almost everything else you will do, we will tell you if you're not supposed to do something. All right. I think that concludes my portion of this lecture, and now it is up to Kristy.
Okay. All right. All right, guys. Hello. We're going to talk about your room real quick. Okay, so just as a reminder, Stan Mann was admitted last night on the med-surg floor at the hospital. So we have that information so you know where you're at. He has a multifunctioning patient room that has med check areas that is going to be in the same location every time you do a sim. So you're in the patient's room as soon as you walk into this room. So typically we will have this cart with all the isolation gear. It will typically be over here. Can you put that right there?
Yep. Right here?
Right there. So typically we will have it right here. So when you come in, thank you, Vanna.
Yes.
When you come in through the door, when it's your turn, you will stop here to put your isolation stuff on first. And then, yes, we realize that you want your gloves right away. They're over here, but we'll probably put those on the cart for you. Okay, so let's see here. Thank you. We're gonna go over here to the sink. So this is gonna be kind of repetitive if you've already been in sim or if you've already watched one of these or two of these or four of these videos. But we wanna make sure that we go over it every single time. So you have your sim sink over here. You've got your sim time. This is the time that you should be going by when you're gonna be doing any medications. You have your sharps container. All needles will go in here. Please do not put them in the garbage or your pocket, or poke your partner's eyeball out. That'd be great. Your gloves are available here, so please remember when you are in sim, you are not going to change your gloves every single time you touch yourself. Oops, I just broke that one. Or touch the patient or the food or the floor or something. We just want you to simulate hand hygiene. And the easiest way to do that is basically to put your gloves on and leave them on and forget about them until you're done with sim. And then just say, I touched the patient and now I'm gonna go get his food. I am gonna give some medications or I went like this, or he's in drop isolation, I have to leave the room. I'm gonna take off my gloves and do hand hygiene before I leave or when I come back in, and then you're just gonna keep them on, okay? But when you're all done, said and done with everything, you're gonna take your gloves off for the final time and just stick them in the black trash can, because that's where everything goes, it's garbage. Everything else that's related to sim, we will put into the blue recycling bin. Okay, so you have an office drawer or a resource drawer. So your resource drawer is gonna have all of your med books for your medications and fluids, IV fluids. And then your resource or office drawer, again, is gonna have pencils and dry erase markers. No pens are ever allowed in the sim lab. Post-it notes and a calculator. And then you have patient supplies cabinet, will be over here. For Stan Mann simulation, everything is already out for you. But if there's something that Ashley forgets to put out, it will be in this cabinet for you. You can grab it. So typically things are going to be right here. Okay. When you're ready to perform a med check, you must pause sim so that we know when you're ready to talk to us. And that also tells everybody else to kind of be quiet so that we can hear you. We also want you to have like uninterrupted time to do your med checks and get through it. Okay, so you're going to perform 2 med checks right here in front of this area of the mirror under this microphone. You can see it. I'm just pushing it around. You can see it hanging. And then once you get done with your 2 med checks, you will go onto the side of the bed where Ashley was standing and perform your last and final med check before you administer meds. Stan Mann has his med box right here. It's in this little location. It's always right here. Because he has IV fluids, we put the dresser over here too, so there's extra fluids and tubing set up right here for you. But here is his med box, and so everything that you're going to need is in here. And then, you know, there's always going to be extra stuff too, because, you know, when you're getting into a Pyxis or some sort of system with medications, it's not typically just one area for one patient. You're pulling meds that are specific through the entire Pyxis system. So make sure you're looking through this and getting what you need. When you're ready to pull a med, a PO med, you're going to do that by simply just taking the medication, keeping it in the bag, sticking it in the cup, doing your 2 med checks against your MAR, going over here, doing your last med check, pretending to give it to him, and then you're going to take this pill and you're going to stick it in this white basket. That helps us confirm what your dosage was for your medication. Okay. To simulate a phone call, you're simply going to say, sim question, and then we'll say yes. And then you'll say, I'd like to call Dr. XYZ. And then we'll say, okay. And we just want you to stand underneath the microphone. Make sure you know why you're calling and who you're calling. And then we'll just simulate that conversation with you. All right, to the head walls. All right, so we've talked about what the bed can go up and down and stuff like that. You have head walls here. Head walls are basically everything I just said. Head walls are at the head of the bed. It's a wall and it has stuff on it. Okay, so you have your air flow meter, your oxygen flow meter, and your suctioning. So in the event that you need to put oxygen on the patient, he has oxygen here. All right, you can actually put it in his nose, like you were expected to do in real life. Stan, I'm gonna put some oxygen on you. Kind of blue. Not sure if you're sad or if you're just hypoxic. All right, here we go. All right, so that is not staying like I want it to. So we're gonna choke him with it. Don't do that in real life. Okay, so that's in there. And then I'm gonna turn my oxygen flow meter up to whatever that doctor ordered. It is not an open type of system. You have to follow doctor's orders for oxygen. And then you have your air flow meter, and that is what you're going to give a nebulizer with. And when you hook up your nebulizer to it, you're going to hook it up to 8 because that's great. And if you need additional information on how to run and put together a nebulizer, the oxygen inhaler, stuff like that, please follow along the BTC SimLab YouTube channel because there are more videos that are short and sweet just on those tasks alone. Okay, where'd my paperwork go? Right here. Hal or Stan, he took it. Okay, so and then let's see. I'm making sure I have everything. Okay, remember, incentive spirometer is out here. Again, there's a video on this too so that you know how to instruct your patient on how to use that. Please watch that video. These are his personal belongings, so you can use them if you need them. Okay. And then, so for Stan Mann, there are 6 stages in this sim. And so if there are only 6 students in your group, then one student will go only one time in each stage. However, if there are more than 6 students, then there will be 1 or 2 students per stage, depending on how many students are in the group. Typically for Stan, we are going to do a med nurse and an assessment nurse. And your assessment nurse is exactly what that is you're assessing the patient, you're assessing what he's telling you, and then you're going to do treatments and interventions. The med nurse is going to take that information, that data, and determine the critical assessments and find out if the medications are indicated or due, and then give them. The med nurse will document on the MAR, the assessment nurse will document on the treatment form, okay, or the TAR. Let's see here. You, when you're waiting for your turn, so you're probably wondering, what do we do for 6 hours or 5 hours when somebody else is going through the sim? You're going to be in the conference room doing homework and just keeping on task in that area. What you won't be doing is talking on the cell phone, text messaging, or social media. We can't have that. So please be mindful of your communication and your volume when you're in there because the people that are performing can hear you. You'll be allowed a break in between every single stage, which is typically between 20 to 25 minutes long for 6 stages. And then once we have a break in between, you can go to the bathroom and whatnot. You also are going to have a lunch break. That's 30 minutes as well. We will, to assist you in your documentation, you will be expected to give report. So when you see your patient and you get done with your sim and I tell you end scene, then you will give report to the following person and so on. When you do that, there are 4 different forms in the conference room that you can choose from and use. They may be helpful to you, you may not like them. You don't have to use them, it's just there as a resource. When you come back from lunch, typically that's when we're going to do our debrief session, which is required for every single simulation. And then you also fill out a survey that's required at the end of the survey or at the end of the simulation. Please be on time for sim. If you're more than 5 minutes late and you've not contacted your instructor, you will not be allowed to come into sim. and it's a missed clinical experience. Please do not be rude, disrespectful, or mean to your peers, your instructors, or sim staff, or you will also be asked to leave for that. If you need information on remediation and removal process, we do have those behavior forms located in your student handbook for SimLab, and they are in the conference rooms in the SimLab. We really hope that this is helpful for you. We are trying to do these videos for every single scenario so that you have a clear understanding of what your room is going to be set up like and what to expect with your simulator. Please email us if you have any questions. Bye.